Female pattern hair loss affects up to 35% of women as young as 18 years old. That's 21 million women in the United States alone. The hair loss comes in several patterns, including frontal, temporal, diffuse, and the most common, geographic, which is all over. Female baldness has emotional and psychological effects, leading to a decreased quality of life. But plastic surgeons are here to help. In this new hot topic study, a team of superb plastic surgeons from Brazil detailed their successes over the past 31 years with a procedure called surgical follicular unit transplantation. This outpatient procedure is performed under local anesthesia and with intravenous sedation. They remove a hair-bearing donor flap from the back of their head, from which they can harvest about 4,000 hairs. Then they use a stick-in-place technique to make a small slit in the scalp and place individual follicular units one at a time. This is very, very tedious. After performing this procedure in over 750 women, they report great results. No major complications occurred, and the women were overwhelmingly satisfied with their final results, which can take up to 15 months to manifest after all the hair has grown in. About 18% of their patients had to undergo a secondary procedure after 4 years due to the progressive nature of female pattern hair loss. With 3 decades of experience, these surgeons conclude that follicular unit transplantation is an excellent surgical option to treat female pattern hair loss. Since there's no need to shave the recipient sites, the operative times can be relatively short and the complications are truly infrequent. For women suffering from this type of baldness, this could be hair-raising news. If you or someone you know want to learn more about this type of hair restoration treatment, make sure you reach out to a board-certified plastic surgeon that has specific expertise in this area.